Good morning. In this video, we are looking at another paraphilic disorder which is called sexual sadism. Okay, the term sadism is derived from the name of Marquis de Sade, who for sexual purposes inflicted cruelty on his victims that he was eventually committed as insane. Sexual sadism as such means infliction of psychological or physical pain on another individual. People with sexual sadism have either acted on their intense urges or have debilitating or distressing fantasies with sexually sadistic themes. Sadistic fantasies include themes of dominance, control, and humiliation. A closely related but less severe form of sadistic fantasies and acts could be bondage and discipline. Sexual sadism is a form of paraphilia, but mild sadistic sexual behavior is a common sexual practice even between consenting adults. Though such practices still involves causing harm, they are not so pathological in nature. In other words, they are limited in scope and they are not so harmful. When it is pathogenic is actually a matter of degree. So among those who have these sadistic fantasies and urges, a small majority of minority of men inflict sadistic acts that are non-consensual, serious, and fatal. So in some cases, sadistic activities leads to actual sexual relationships, and in others, sexual gratification is obtained from sadistic activities alone. So when the person engages in sadistic activities with a non-consensual person and it is very serious and fatal in nature, then it constitutes criminal activity, and it is likely to continue until that particular person is caught by the police or other law enforcement officials. Okay, so as I had already told you, some people with sexual sadism have debilitating fantasies that are distressing. Some act on them but not in very lethal ways, but some go on to become sadistic killers. Hence, the assessment of sexual sadism has to be done in a dimensional way. That is, you will have to see that particular person on a spectrum. So rather than employing a categorical approach wherein we say that the person either has a disorder or does not have a disorder, here we look at differentiating a person who are killers, sexual sadists who are killers, and those who are not. This is because when given a diagnosis of sexual sadism to someone whose sexual desires are harmless, it could lead to stigmatization, and at the same time just leaving off people who are dangerous sexual sadists could land us in more trouble. So it's important to see where they are in that particular spectrum. The other way of looking at is to focus on behavioral indicators of these sadistic fantasies and acts and behaviors that may give us an idea of how severe or lethal such behaviors are. So in DSM-5, the diagnosis of sadism is done when the person usually involves a victim who is non-consenting, or in which sadistic experiences are marked by distress or interpersonal difficulties. Okay, here are some of the facts about sexual sadism. Sexual sadism have comorbid disorders, especially the narcissistic, schizoid, and antisocial personality disorder. And when combined with antisocial personality disorder, like you see in the case of Ted Bundy, a serial killer, sexual sadism can be very fatal. he could end up killing a lot of people. Extreme sexual sadists may also replay their torture scenes later, and serial killers who tend to be sexual sadists sometimes record or videotape their sadistic acts. So why do they do all this? The godlike sense of being in control of the life and death of another human being is so exhilarating for them, and is supposed to be a central theme of this particular sadistic disorder. Okay, so when you look into the causes, there are no specific causes for sexual sadism, but there are several theories. One such theory is that they tend to have a sense of power for someone. They generally may not feel powerful in day-to-day life, but by acting out on their urges, fantasies, and they can have a feel of power over someone. The other thing is is the release of suppressed sexual fantasies or progressive acting out of sexual fantasies over time. That is, they may begin experiencing erotic fantasies involving infliction of pain early in life, and this often increases in frequency and intensity as these people enter adulthood, and then they begin to act out on these fantasies. During the adulthood, the degree of violence needed to become sexually excited gradually increases, like you see in drug tolerance. And APA also states that when the sex drive diminishes and the age increases, the urge to engage in sadistic acts can also come down. Treatment, as I told you, when combined with certain comorbid conditions like antisocial personality disorder, it can be very challenging to treat people with sexual sadistic disorder. But there are psychotherapeutic approaches that are employed to treat people with sadism, which involves cognitive behavioral treatment, wherein we talk about cognitive structuring and empathy training, trying to have some sort of an empathy for their victims, and behavioral techniques, which include aversion therapy, like what we saw in fetishistic disorder, and systematic desensitization and all supposed to kind of help them. Pharmacological approaches to treatment include use of antidepressants to reduce impulsivity and anti-androgens to reduce sex drive. So that brings us to the end of this video. Thank you.